So welcome everybody to our third in our school webinar series on the role of different AHP professions. And today we're going to be talking about the role of the operating department practitioner. So as you know, if you've been to some of the webinars or listened to the webinars, the last two that we've done, the AHP professions are the third largest workforce in health and care. In the main, we are degree level professions and are professionally autonomous practitioners. There are 14 registrable titles. If you can move on to the next slide, Rom, sorry. Titles for AHPs covering 15 specific roles. And you'll notice on this slide that there's 16 professions. And that's because in the UK, prosthetists and orthotists are dual registered as one profession, and radiographers, diagnostic radiographers and therapeutic radiographers are counted as one. There may be some professions that you've never heard of, and if you're interested in a career in health and care and you don't know what yet, I'd encourage you to have a look at all of the AHP roles. AHPs provide system-wide access to care to assess, treat, diagnose and discharge patients across health, social care, housing, education, independent and voluntary sectors. Through adopting a holistic approach to healthcare, AHPs can help manage patients' care throughout the life course from birth into death. Their primary focus is on prevention and improvement in health and well-being to maximise the potential of individuals to live full and active lives with their family circle, social networks, in education, training and the workplace. Within the webinar series, you'll hear about 7 AHP careers, and today's focus is on operating department practitioners, or ODPs is the acronym. And this webinar will take you through the role of the ODPs. We have 4 ODPs talking about their careers and roles, and this will be followed by a presentation from Tom talking about the ODP apprenticeship programme at the University of East Anglia. There is a national drive to recruit 80% of our operating department practitioners through a degree apprenticeship, and within our organisation we have 19 degree apprentices on the programme, with an ambition to have 10 more new starters in this next financial year, which is really exciting. Just for housekeeping purposes, I'd be grateful if you could keep your cameras and microphones off for the webinar. There will be opportunities for questions at the end, and please do write them in the chat as you think of them. And this webinar is being recorded, and we are uploading this recording onto YouTube, so that other people that weren't able to attend at the time are able to see it. And without further ado, I'm going to hand over to Romilly, who's going to talk about the role of the ODP.
Hello, so my name is Romilly. I've been an ODP for 24 years now, and I've just remained at the trust that I have started, which has been SNEFT. Going through just to give you some outside information about ODPs, we are registered with the HCPC, as Nick has already shared, but actually we're a small number of us. There are 15,000 approximately registered with them. Just into comparisons with that, we got the paramedics at just over 30,000, and physio, they're going to be double that. So physio at around 60,000 registered to be supporting patients in various forms. You can do the direct route, where you go directly to apply for a university, but actually what we're going to be sharing today is going through the apprentice pathway. The apprentice is the earn while you learn, and the direct is you go through to the university. The ODP role is split into 3 sections before you come to the point of qualification, and it looks at anaesthetics, scrubbing in for the surgeon, and also into post-op anaesthetic care, which is the recovery ward environment. When we look at SNF itself, we have 17 plus different specialities that our operating theatre support over the time. Now, it could be 24/7 surgery, so it could be emergency and elective. Some of our emergencies, which Katie will be sharing shortly, we also have obstetrics, so we never know when babies are going to arrive, but we do have a 24/7 service. We have 46 theatres across Essex, that's Ipswich and Colchester. They are split into different areas, but also each theatre suite will be looking at specific or like specific specialities. In some of our areas, we're now looking at robotics. So robotics is really exciting now. It's where the surgeon will operate on the patient from the corner of the theatre, and the robot itself will be doing the actual operation under constant guidance from the team. So this is really exciting. We're able to do that on a couple of specialities from gynae and which is also urology. Essex is the Essex and Suffolk Elective Orthopaedic Centre. It is the largest centre of its kind in Europe, where we have a capacity to operate on around 10,000 patients per year. They're elective orthopaedic, so that would be upper limb and lower limb. We also, as a trust, we support ODPs, so we will have to provide, for example, anaesthetic anywhere that the anaesthetist deems that's necessary. So we will go where it may be, there may be an emergency on a ward, a cardiac arrest, which Katie's going to share for you shortly, but it could also be that we're going to support them in other areas such as cardioversion clinics. So we are able to go in different places depending on what's required of the ODP. In the actual theatre environment, you do work with MDT, so that's multidisciplinary teams. You will, when it comes to patients, and this is what patients will also be able to be safe in the knowledge of how many people are involved. So if we're looking at particular one patient coming in for an elective, you're looking at about 12 members of staff who will be involved in that person's care. If it's an emergency where it's a real true emergency where we've got looking at perhaps something life-changing or something more significant, you could have at least 20 plus people in the operating theatres all trying to support and provide the best care for that patient. We have theatre assistants, so you will see Harry and Olive shortly. They're theatre assistants, so they are actually part of our workforce, and they are worth their weight in gold. And that's the pathway that they tend to go through for the apprenticeship route. The theatre assistants are there to help us to collect the patients, bring them to theatre. They will support us in the actual operating theatre by circulating. It's a really good role, and that's where anybody wishes to go down the ODP pathway. That's the role for them. We have nurses who support us too. We have them in recovery to support that patient, but also they actually scrub for the surgeons. We obviously have got ODPs in all areas, anaesthetic, surgery and recovery, which we'll go into shortly. There will be, of course, lots of surgeons. They come for different specialities. We have male and female surgeons coming through to support our patients. Our anaesthetists are doctors, so you will find that they will come in different grades and they will be running the lists. And we have other professionals that come through that require to provide patient care, including radiographers. You may also get some people from clinics to come in to support and provide patient care too. So an ODP has to be able to work really well with a varied amount of different professions coming through. When it comes to the ODP role, although I said about they come through scrub, anaesthetics and recovery, they actually will also circulate as well as scrub. So a good circulator is the eyes and ears for the scrub practitioner. They will have everything ready and be the runner for that surgical practitioner. The surgical practitioner, again for ODPs, they will be assisting the surgeon, so they will be passing the necessary instruments. They do have to predict what's going to happen. They will also be in charge of looking at all the equipment, making sure everything is correct, so they have complete reliability and also responsibility for what they pass over to the surgeons. The surgeons are there, will rely on the scrub practitioner to support them. The ODP can also be in anaesthetics, which I did. I was more anaesthetics than scrub. I really enjoyed the element of anaesthetics because it was so varied. You definitely were kept on your toes for anaesthetics. And this is to support the anaesthetist with any form of anaesthetic. So it could be supporting with the obstetric lady who wants to have a spinal anaesthetic. It could be somebody who is very poorly that requires specific lines like a big cannula to go in, or on what's known as an arterial line if they go into critical care, or it could be just to support them with a particular procedure that needs a certain airway. It's whatever the anaesthetist needs. We then work into recovery. So we work in recovery, giving one-to-one care for that patient. They could be only in there for 10 minutes. They may also be in there for several hours because they need enhanced recovery. So that's more input. And the aim for recovery is to, of course, build up rapport and make sure the patient is happy to share if they're comfortable. But we want them to go back to the ward environment, pain controlled. So the recovery person will be there to support them. We have ODPs in managerial roles within theatre. So we've got some who might be the shift coordinator. So that's coordinating all the theatres in the row at that time. And we do have ODPs who are team leaders. So they will have their own team and their own line managing pathway, as well as supporting with the operating lists. We also have some ODPs who are clinical leads. So they are in charge of theatre suites, and they will take full responsibility, and then they will have team leaders who will then escalate that down. But we can have some good management movement within the ODP role within theatres. What qualities is needed to be an ODP? Sometimes it's quite a hard one, but I've picked some of the most important ones, I think, and I'm sure that others may be able to add to that. But you definitely need to be an excellent communicator verbally and also non-verbal, because you're going to have patients come through who will be able to commute in different ways, but you also need to build a rapport up really quickly with a patient who may be really fearful, who might be a little anxious about what's happening to them, or it may be that it's a 3-year-old toddler that's crying. You're going to have to help them to be able to give us that option to anaesthetize them. You have to be really good of attention to detail. You have to really look around in the operating theatre and keep an eye on every element, because something can change in that patient really quite quickly. Being organised. Now, it is a really key thing that if you're organised, you will have generally a really good list, because you will get information fed to you that we need to then act on. So we need to make sure we're ready for plan A, B, and C, but also the next patient. So having everything organised. Being a problem solver is something that is a daily occurrence. It could be that they are operating and they want to take pictures from a camera, or they've got a piece of tech that's not working. So if you're tech minded, it's really good to look at that problem. Or it could be that we need to change the order of list, and we are there to support that or to put that idea across. Change happens, and change can happen quickly, and that's whether it's the patient who's actually on the table, or whether a patient is coming through to the door. So again, we have to react to change, know exactly what we need to do, and be adaptable to making sure that patient gets all the care that they need. And the art of delegation comes with that too, delegating to others to ensure that we can get everything we need for that particular patient. You're also advocate for others. It's not just for the patient, but you may be an advocate for students that are in the environment. It could be that it's for the relatives. It could also be for other members of staff, that you're going to be advocating for other people. So that's really good qualities to have. We look at future careers. The world is getting a lot bigger for ODPs now. We can go and do a lot more than what we'd previously done. So you can come into education. I'm in education. I'm a lead practice education facilitator, and I've gone through the education pathway for the last few years. We do have ODPs in management. Now, management doesn't mean you can stay within the ODP field. You may wish to do management in particular areas like operations. So it's looking at the trust, how the hospitals work. It's the individual's choice. You can work overseas. So Australia is one area that the ODP profession can carry you over. There's also just slight different changes. You can also look at New Zealand too. So it is available if you wish to travel. The enhanced roles is really important. So they will come through. We're starting to see that more in the ODP role. So they're looking at anaesthetic associates. So they actually go through some master's training. So that's at level 7, to then be able to run their own operating list for patients who have met the good criteria, that there are no concerns. So that's really good. That's really exciting. And they can also do that in other ways of being in enhanced roles, such as an emergency care practitioners. ODPs can work in other clinical areas, so it may be that they work in A&E, resus, they can work in critical care in some places. So it's very much looking at the skills of the ODP and where it actually takes somebody. So there's always ODPs working in different areas. We've got ODP working in blood transfusion here at the moment. So it's the world is looking at that world as the oyster. You may wish to specialise, so specialising in any form of ODP. So it could be that somebody wants to specialise in orthopaedics. I've got an ODP that I worked with. She specialised in liver transplants. And now she actually has got the exciting life of being in America, and she's in really important role in looking at liver transplants for the future. So they're looking at different how the machines work. So you can do something as exciting as what Lucy has done. So it's fantastic. So there are lots of different future careers available to you, and if you're going down that pathway. So yeah, it's always worth asking if you want to go down that pathway. There's always some support that will be available. So that's my part over. Goodness, you right, Nick?
Yeah. No.
I was going to hand over to Katie next.
Lovely, thank you, Romilly. So my name is Katie. I'm an operating department practitioner by background. I've been an ODP for 5 years, and I'm now the lead clinical educator for theatres and anaesthetics at Essex in Ipswich Hospital. I'm going to talk a little bit about the acute, so like the serious and sudden side of being an ODP, and the emergency side, and how we work within the multidisciplinary team. As you can see, there's a picture of me doing some training there. I like to put some pictures that you can relate to. Romilly, can you move forward to the next slide, please? So one of the things we do as an ODP is we carry a bleep. So this is an emergency bleep called 023, and it's a mobile anaesthetic unit. So Romilly did touch on it slightly. Wherever an ODP is needed in the hospital, that person will go. They'll carry a bleep in their pocket, and if there is a cardiac arrest, so a serious heart situation that comes up, or major bleed somewhere in the hospital, we grab our bags and we take them to the scene, and we work alongside a very big team of all different professionals: doctors, radiographers, nurses, healthcare assistants, all those people that Romilly mentioned. You go to an emergency and they will be there. And we are available 24/7. So we work 12-hour shifts when we do those bleep calls. And the team is made up of operating department practitioners and nurses who have carried out anaesthetic training. So they're part of it as well. And this takes us all around the hospital, which could mean going upstairs to the 8th floor in the middle of the night. But luckily, we do have lifts to get us up there. We carry what's called scram bags, which are checked every day. And it's important that we carry the very minimal of what we need for an emergency situation. We have to know everywhere we're going around the hospital. So when I started it took me a long time to learn it, but you do, suddenly it comes to you and you learn exactly where you've got to go in the different locations. Our main job when we turn up to an emergency call is to look at manage the airway with the anaesthetist. So the anaesthetist will guide you on what we need, what equipment they might need, and we work within our scope of practice. So what we were trained at university to do to manage that patient's airway and make them as safe as possible. Can you move on to the next slide, please? Thank you. So this is a picture of what we call a scram bag. We carry this around with us. We have 2 bags that we have to carry with all our emergency equipment in it. What I found here was a definition of a person that would go on these calls, and it says here was a dedicated and appropriately trained anaesthetic assistant who is familiar with the environment. They're available in all non-theatre environments where anaesthesia or a person is required to be put to sleep lightly, and that is undertaken by the anaesthetist. So we are there to support them during that. When we are holding the bleep, we are the first responder for surgical emergencies. It means that we respond quickly to emergency calls for surgery and anaesthetic requirements. We prepare theatres quickly if patients needed to be brought up for emergency surgery. And we often work under pressure. And we are saving lives in critical situations. That's what we are trained to do. Could you move on to the next one, please? So the next part of being an ODP in the acute and emergency side of things is what we call the NCE pod, which is a national guideline for emergency surgeries across the UK. We call our CPOD here at Ipswich, and it's one theatre which is dedicated to emergency surgery. So on any given day, we'll be performing various surgeries, such as one is called a laparotomy, which is major surgery on the tummy. So a patient is opened up and various parts of the tummy are operated on. We might remove someone's appendix if their appendix is unwell. And what we're doing in emergency surgery is we're focusing on addressing life-threatening conditions that require immediate surgical action. So some of you might have had your appendixes out before, or emergency surgery for tonsils. We would have been there, an ODP would have been there to help in that situation. You might not have even known it, which I think is a really nice way to look at it now, definitely. We can help in surgeries where someone might have been in a car accident and they're having internal bleeding. So we're helping fix that. Romilly talked about C-sections, so people who are having a baby and it might be an emergency, things might happen and progress very quickly. So we have to be there to support that as well. And any situation where the patient being made to wait could be dangerous for them. So that's what emergency surgery covers. And if you could move on to my last slide, please, Romilly. Thank you. So this one, I just wanted to grab a few images really of what we do. So on the left there, you can see a simulation doll. So for training for ODPs and all staff, we do regular simulation to help us understand what we need to do in an emergency and how to manage it. The middle bag is a photo of the drugs that we carry around. So Harry will be familiar with this as well. He's a carrier of the 023 bleep. And we have to make sure this is stocked and used effectively in emergencies. And on the right-hand side, it just shows, I know the writing's quite small, but it just shows how regularly we update each other on changes, medical and NHS updates regarding carrying the bleep. So, for example, there's one on there about a dosage of a drug. So if national guidelines change, we have to be informed, and then we have to update our policies according to that. And at the top there, I just got a little quote from AFPP, which is the Association for Perioperative Practice, and just a bit about ODPs. And I think it's quite true, really. So the rewards of it has a real-time impact on patient outcomes. Like we're there and we're dealing with patients in the moment. We work in a dynamic, fast-paced environment. And there's lots of camaraderie. So there's lots of we have banter. We tell jokes. We try to enjoy our time, even though it can be high pressured and stressful. And there are challenges. You know, it can be physically and emotionally demanding. We do often work irregular hours, which includes nights and weekends and on calls. And we do face stressful situations where we're required to be resilient and make decisions. But overall, I'm proud to be an ODP. And I know there's other people in this room here that are proud as well. And Olive, who's currently going through the programme, we're supporting her, and she'll get to tell you her impact and how she's feeling in the training at the moment. So that's me. Thank you very much for listening. And I believe I'm passing on to Harry now.
Hello, my name's Harry. I'm actually a qualified ODP practitioner. I've been qualified for 2 years now. And I achieved my qualification through the apprenticeship scheme. So I started off as a theatre assistant, which I was a theatre assistant for 3 years prior. And then I went from being a TA to starting my 3-year course, which was all funded by my local hospital. So when thinking back as a TA, I remember feeling a mixture of feelings, mainly curiosity and like nervousness, because I was completely new to the inner workings of theatre life. So going from such like a normal job prior to then coming into theatre and seeing all these weird and like strange but amazing procedures, it really took me an overwhelmed me. So I remember in those early days, the thing that really stood out to me was teamwork, and how like even like a supporting role or a little role within the patient's care can have such an impact to the patient's safety and their overall care. And seeing those different roles is kind of what spurred me on to do the ODP apprenticeship, because I wanted to not just stay in one role, I wanted to learn them all. So when I started my ODP apprenticeship, I was excited, but it was also quite daunting. I went obviously from being experienced in one role to suddenly being a learner again, and obviously learning multiple roles throughout the patient's preoperative journey, from helping the anaesthetist on the anaesthetic side to scrubbing up with the surgeons, and obviously recovering the patient afterwards. So that's one of the best parts of being an ODP, is that you're not just stuck to one role. You can branch out and you can do multiple roles and learn different skills, and you are literally the heart of the theatre, which is a nice feeling. But yeah, the early days of being an apprentice, I remember I was quite worried and overwhelmed, because I was worried about balancing all the academic side and the practical side, and obviously my personal life as well. So I remember feeling like maybe I wasn't capable of doing it, and if I wasn't learning fast enough, or if I couldn't step up to that clinical decision making role. But throughout the journey, the one thing that kind of helped me through it was the support of my colleagues, and some of them who I can call friends, and obviously their education team. They offer such brilliant services and support, and not just to apprentices but to traditional students as well. And that is really what got me through the whole thing. And so transitioning from a familiar kind of hands-on support role to that newly qualified ODP came with new pressures. Suddenly the responsibility of the patient care was like, I was more responsible for that, and I had to learn and trust my training and kind of adapt quickly to what I've been taught, and build my own voice within the multidisciplinary team. And it's quite important to obviously remember that you are part of a team, so you're never by yourself, because sometimes you can get in your head and be like, I'm solely responsible, but you're not. You've got other people to like bounce off, and to other people to support you throughout the patient's care. So and that's like say that, and then you feel part of the team, and you feel proud of yourself that you're contributing to this patient's care. But yeah, as I obviously continue, I am also really grateful with the opportunities I've been given, and I want to try and take this as far as I can. And like I say, I do recommend the apprenticeship, or recommend the ODP degree to anyone, because it is an amazing job, and you're doing such a benefit towards the patient. So but yeah, that's my experience.
I love that, Harry. Thank you very much. Thanks for sharing that. Warts and all, it's brilliant. And what shines through is that you love your role. So thank you very much. And with that, I'm going to hand over to Olive.
Hello, my name's Olive. I'm a second year degree apprentice. I am currently heading towards my third year, my final year. I started with ESNEFT in 2022. I was fresh out of doing my A-levels. I was 18. I didn't really know what I wanted to do, and I was working part-time, but I knew that I wanted to do more than just my part-time job. And so I took a chance and I applied to the hospital. Come July, August 2022, I found myself in obs and gynae as a theatre assistant. And I remember my very first day, I was like, oh my God, I've found what I want to do. I really want to be in healthcare. Being a theatre assistant in obs and gynae, as Katie's already touched on, we do a lot of emergencies. So I was very kind of quick to be familiarised with the emergencies that we have. So like emergency sections, we have different grades of them. We do also have emergency gynae procedures as well as elective. But I have to admit, I had no idea what the operating department practitioner role was. And I remember seeing ODPs in theatre and seeing what they were doing, mostly anaesthetics, but also doing scrub as well. And I remember speaking to my mentor and saying, you know, what is this job role? I'm fascinated. And from then on, I really worked hard to pick up as much knowledge as I could to work towards doing this. And I didn't realise it was an apprenticeship at the time. But speaking to my manager, it got me on the track. So what I would say the benefits of being an apprentice, you get to know theatres, you get a really good basis of knowledge. I found the best thing about being an apprentice is that you already work with so many of the various members of staff and the multidisciplinary team across the theatres that you have familiar faces, so it makes it so much easier to go and talk to people if you need anything. And as Harry mentioned, the education team have been fantastic, really supportive. If I've ever needed anything, they're there for you. You can talk to them about anything. But I actually started the degree in 2023. And I was really scared. I had no idea what to expect. But the support of the other apprentices that I'm on the course with has been amazing to have. You can all share your experiences, and it's always different because you're all in different areas doing your different rotations. So one day I'd see something that was really interesting and I'd be able to share that with my colleagues, and one day someone else would see something really interesting. But it's a fantastic job role. Even as a theatre assistant, you collect and you circulate. I felt so proud doing that and talking to patients. It's one of my favourite things, communication. But building on that and moving towards a slightly more responsible role has been really good in terms of progression. But as I say, that having that foundation of knowledge has been really, really beneficial to me. Moving forwards, I felt more prepared for it. But it is such a fantastic career. As Harry said, I want to take it as far as I possibly can. I've got my third year to go, so fingers crossed for that. But I would definitely recommend to anyone to 100% do it. It's so good, so beneficial, and you feel so proud of yourself and the accomplishments as well.
I can't stop smiling. I'm so, thank you very much, Olive. Again, you talked just so brilliantly about the role, and thank you for agreeing to speak. I'm going to ask a question because we've got 2 minutes quickly before I'm going to hand over to Tom. But anyone, if there's people on the call that think they might want to do it, what would be your top tips? Harry or Olive?
Top tips.
Yeah.
I would say if you can do some theatre assistant work beforehand, it's brilliant. You get to talk to patients, you start to build your confidence in theatres, and you get like the basis of knowledge that I've had. I can't say enough like how beneficial it has been. But then also at the same time, speak to everyone, ask lots of questions, because I found that has like really helped clear my knowledge and bring up my confidence as well.
Yeah, my top tip would be, if once you're on the course, I would try and take every opportunity that you can, because even though you get support from the PEF team and they can guide you, ultimately when you're on the course, your learning does come down to you, and it's down to what you're willing to do. And if you take every opportunity to learn the job inside and out, and from different areas, go to ophthalmics, go to orthopedics, go to gynae, and learn it all, it builds up your confidence and it makes you feel like you're more capable of doing the job role. So yeah, just take all the opportunities you can.
Thanks, Harry. And Katie?
I was just going to say, and I'm sure someone's going to mention it at some point, but we do take work experience students for one day in theatres here. I think it's 17, age 17 is minimum, but you can plan it ahead so that you can come once you turn 17. But our talent for care team arrange that, and you can literally come and spend a day observing in the operating theatre, come and see exactly what we do. And it has been beneficial to those, and we have had people that have done that and then gone on the course. So just a little recommendation from me there.
Thank you, Katie. And if you're interested in thinking about work experience, that's email for Ipswich and Colchester hospitals. You can email workexperience@esneft, ESNEFT www.nhs.uk. Thank you. And with that, I'm going to hand over to Tom. Tom is from UEA and an ODP.
Yes, many ODPs today. Hello, everyone. I spent a decade as an ODP in emergency surgery in the north of Norwich. I loved it. I very recently became a lecturer. Oh, fantastic. You got my little presentation. That's very kind. Yeah, I loved being an ODP. I also love being a lecturer. So it's best of both worlds for me, frankly. When we're looking at the apprenticeship, do I have control of the buttons? I do. Fantastic. I have
control, Tom.
You have control. Well, please can you on to the next slide for me? Are we on overview? Fantastic, cool. So key factors for you guys to know. It is employer-led, so you can no longer apply to, there are some direct accesses still, but generally, as mentioned, we're moving towards the apprenticeship model. So you need to apply through the employer rather than through the university to get onto the apprenticeship, and it is funded by the trust. So generally what will happen is you'll be working at the hospital for a while, and then that is something you apply for, will be put forwards for, and you can kind of, in a way, spend your first few months or so or year as a TSW kind of thinking it as a mini job interview, because what we're looking at is people that we can support for those 3-year degrees and who really are passionate about doing the job in the future. Compared to direct access, incredibly similar in most ways. It's still a 3-year degree. You still come out with a degree qualification at the end of it. It is, however, much more online these days because we're delivering these projects nationally. There are various providers that you don't really need to worry about quite so much because that's down to your trust to choose between sort of Derby, ARU, and of course the best one being UEA. Our apprenticeship starts in February as opposed to September for all the others, just so that we've got a little bit of a niche. So if you are partway through, if you, for instance, miss the September, go to February at UEA. If you miss UEA at February, then just go September at another provider, though I'm sure UEA would be a much better experience. Anyway, incredibly similar to direct access. Next slide, please. So on the logistical side of things, this is what we're kind of looking for. I don't want to go too in depth with this. I'm hoping you're all able to see it. But we're looking for GCSEs grade A to C, BTEC level 3, health education diploma, pass with 45 credits at level 3. These are all rough estimates. There is flexibility on them, especially with recognition of prior learning, experience in theatres, that sort of thing, because as all the ODPs, hopefully, who are in the room can agree with me, we can teach you how to be academic, we can teach you to pass exams, but what we want is good, solid people who are going to look after people in some of the most vulnerable moments in their life. If you can imagine there's the point in time where you are going to be knocked unconscious and looked after by someone, who do you want that person to be? So we're looking for good people with the bonus benefit of being academic over just being academic, if that makes any sense. And next slide, please. Cool. So there is English language requirements for non-native speakers, but those tests can be done either through university or through the various trusts, just to make sure that you'll be able to keep up with the academic side of things. There is still an element of essays and academic writing that is part of the whole degree, because we teach you to think critically and to really question and improve. That's one of the main benefits of moving to the degree from the diploma. As Katie very kindly pointed out, a lot of the physical training for the online apprenticeships is now done at your trusts, which is good because Katie and the team have got those fantastic resources. They've got the sim suites and all those things. It's very fancy. Obviously, we have our own sim suites, but if you're not going to come visit, then you'll use your trusts. To be selected, it'd be good to have a solid knowledge of health and social care and the profession. Speaking as an interviewer, you'll have a much better chance of getting on any of the courses if you have a level of experience and knowledge of the job. It is possible to go from HCA or other jobs to the ODP apprenticeship, but as our wonderful students and recent ODPs have mentioned, being a TSW beforehand is incredibly helpful. That's how I got into the role 1,000 years ago, because just having that extra knowledge just really puts you a step above to begin with. And there is a side effect now that, due to the fact that we are going through the apprenticeship run direct access, you have to meet both the employer conditions and the university conditions in order to be accepted, as opposed to just hitting the university conditions. Realistically, 90% of those are the same, but it's just something to be aware of and just something to bear in mind when you're planning things forwards. Next slide, please. And this is the last one. So I will, if you guys don't have access to this, I can pop it into the chat. These are just some links which can give you some more information if you're interested on the apprenticeship side. Anthony Jeremy is our main lead for our apprenticeship program at UEA. He's a very driven, intelligent man. He can answer any questions that you need. If there's any questions, please let me know.
Thanks, Tom. Whistle stop tour and lovely promotion of UEA.
Wonderful.
Has anyone that's on the chat on the call got any questions? If you either like to raise your hand and we can unmute yourself, or you can put them in the chat. I think we've lulled you into silence. With that, then, I'm going to do some promotion for the next event. So the next one will be in July, on the 2nd of July, and that will be talking about the role of the occupational therapist. And then we have a pause over the summer before having more webinars in the autumn and into the winter on radiography and speech and language therapy. I'm going to say thank you very much for those that have attended. Thank you for coming and listening. Hope you found it interesting. And thank you to our lovely speakers for spending their time making the presentation and attending the event. Have a lovely afternoon, everybody. Thank you.
Thanks, Nick.
Thank you.
Bye.
Bye.
Bye, everyone.
Thank you.
Cheers.
Thank you. Bye.